Portsmouth has been recognised as the most densely populated city in Europe outside of London, with many challenging socio-economic and health issues. But things are changing. Less than 12 months since it was formed, NHS Portsmouth CCG is already rising to those challenges.
All of our decision making is clinically driven, and this has allowed us to re-establish relationships with our secondary care colleagues, which has enabled change to happen. We've not been focused on the bureaucracy and the money. Our agenda is around quality and outcomes for our patients.
I think we're more responsive to the practices. They have greater access to us. We recently had a problem that was highlighted to me. I knew who to speak to straight away, and within a week we've resolved the issue and the information's gone back to practices, and that accountability trail is short and the issue's resolved.
Transition has had both challenges and rewards, such as winning the hearts and minds of patients and simplifying processes between the NHS and the local authority by pooling resources.
A key challenge in setting up the CCG was the frustration expressed by our GP members that integrated care was only a theory and not reality. And they were frustrated about operating in a fractured system, to use their words. So what we've done is set up a primary care provider development programme which supports our member practices coming together to not only design how to get integrated care into reality, but also think about how they could be providers of some of that integrated care with other partners in the system.
There are some key areas working with the Clinical Leaders Group, which is a group of local clinicians from 2 CCGs and the local secondary care trust get together regularly, and we find solutions to potential problems and look for developments that will benefit patients. Through our Health and Wellbeing Board, we have singled out in particular dementia and 0 to 5 in children for areas where we can joint work together. With the patient participation groups, which each practice has, we've managed to get together a big group where we explored what was key to patients, and also to put across the story that we have to tell about what we're trying to do and achieve on their behalf.
I guess we've already proven that we can make change in our new diabetes service that we've procured, which is truly a community service that faces into the hospital rather than a hospital service that faces out into the community.
It's really important to us as a CCG to recognise the need to work with partners and local organisations to bring about real change. If we don't work with our partners, then we will have a fractured system, we will have inaction, and patients won't get what they really need.
With such strong clinical leadership and integrated patient-centred collaborations, future healthcare looks assured and cohesive.
Going forward, I think we must realise that we are an island, but we can't be isolated. It's going to be very important, the relationships we're building at the moment, and making sure that they grow with our providers and also our stakeholders being the public and our membership, and also making sure that we get the best for the Portsmouth pound.